CDC is responding with the following strategy. Our goal has been to slow the spread of this virus through a multi-layered, aggressive containment and, as needed, mitigation effort. We're using evidence-based public health interventions that have included early case recognition, isolation, and contact tracing. We've issued travel advisories and dealt with targeted travel restrictions, as well as the use of quarantine for individuals returning from transmission hot zones, including through funneling of flights from Hubei province and mainland China to 11 airports. We've worked with the CBP to get data to ensure that appropriate follow-up could happen through the state and local public health departments, and we've supported the quarantine of repatriated Americans from Hubei province and from the Diamond Princess cruise ship. We've been working with the World Health Organization and ministries of health around the world, underscoring our leadership in global public health and the power of our investments in international influenza surveillance and global health security. More than 1,500 staff at the Centers for Disease Control and Prevention have been responding to this outbreak. The situation today is evolving and dynamic. In just 2 months, this outbreak has grown from a cluster of pneumonia in China in one city to affecting over 70 countries and territories around the world, with more than 90,000 cases and about 3,000 deaths. We are now in the United States seeing, in addition to the very small number of travel-associated cases or close contacts, we are seeing community transmission in a few areas and a tragic outbreak in a healthcare facility or a long-term care facility in Washington State. Our hearts go out to the people affected by this virus, directly or indirectly, and to everyone who's working so hard to counter it. There are steps each of us can take. I want to recognize that people are concerned about this. As always, our #1 priority is the health and safety of the American people. And we appreciate that Americans are taking this threat seriously and continuing to seek information about how they can prepare. While the immediate risk to the general American public remains low, and the U.S. government's doing everything we can to keep it low, risk varies by exposure, and some areas of the country are now experiencing community spread. State and local jurisdictions where community spread of the virus is occurring are intensely investigating and assessing potential community interventions. CDC's got staff on the ground in Washington and California and elsewhere to provide technical assistance. Our role in this type of community measures is to develop principles and tools based on our updated pandemic planning playbook and based on what we've learned from other areas that have been experiencing the outbreak, including in Singapore, where they've done a very good job of managing it. A key planning principle is to protect the most vulnerable. I trust you as senior leaders in your communities to help us with our mission to provide clear information to you and your constituents by urging people to get the facts from cdc.gov, which you can see up there. And I want to say that I look forward to answering your questions.